Today we're going to discuss the many reasons why we have dark lower eyelid circles. I'm Dr. Joel Kopelman. I'm a facial plastic surgeon in Manhattan. If you're new to my channel, please subscribe below and you'll stay up to date on the latest cosmetic treatments. To start, one reason we have dark circles is that we lose volume in the mid-face area. Why is that? As we age, we start losing soft tissue volume, specifically the skin, the muscle, the fat, and the underlying bone can atrophy and creates a depression in this region. This depression is like a hollow valley, and there's shadowing in that area, and that shadowing creates this like trough which projects a dark circle to the outside world. There are a few remedies to fill in this region. Two specific remedies are, number one, using artificial fillers like hyaluronic acid gels called Restylane, which doesn't cause excessive swelling, can actually fill this area up, and by elevating the soft tissue, it helps to improve the dark circle appearance. The second remedy, or second option, is really to use your own fat, which can be obtained from your belly region or from your hip, and inject it in this area. Of course, that's a surgical procedure to remove fat from one part and graft it into another part, so it's a little more involved. Both have pros and cons, which we can discuss at a later date. The second reason that is common to have dark circles is due to pigmentation. Pigmentation is due to cells that accumulate in this area, which specifically are melanocytes. These are the pigmented cells of the skin, and some people have a accumulation of these pigmented cells over here, and those cells could either be relatively superficial or deep. The superficial layer of pigmented cells can be treated so that they don't form as much melanin, or we can actually depigment some of these cells to lighten the skin. Sometimes there's a combination of both volume loss, as I mentioned, the number one reason, but secondarily there can be this pigment which could also contribute to dark circles of the lower lid. The superficial pigmentation can be treated with topical medications, both over-the-counter and prescription drugs. The over-the-counter products containing hydroquinone, usually at a 2% concentration, or kojic acid, or arbutin, can be effective in some patients. However, other patients need to have a stronger percentage concentration of these drugs, and that requires a prescription from your doctor. Either dermatologists or plastic surgeons can provide that. On occasion, this depigmentation can be stubborn to reverse and may require tranexamic acid injections to try to reverse some of the melanocyte synthesis. The third reason why people may develop dark circles is that there is a vascular component. What I mean by that is there could be dilated blood vessels under the skin which can give a rosy appearance to the inner aspect of the lower lid. In these cases, we have to use medications, usually topical medications, that constrict those blood vessels that can then reverse some of that rosy darkening appearance to the inner corner of the eye. Specifically, drugs that contain oxymetazoline or bromonidine, and very occasionally we use lasers like pulse dye lasers to constrict some of the blood vessels. Occasionally people are born with deep set eyes that also give them dark circles in their eyes. This is a difficult problem to reverse from an aesthetic point of view. It sometimes again requires injections. Sometimes, believe it or not, injections beneath the orbital tissues to allow the globe to come forward can change the volume of the lower lid circles. I hope you found this video to be informative on dark circles. If you have any further questions, please leave them below. I'm happy to answer them, and I look forward to seeing you in my future videos.